any number of us, certainly starting with myself, I mean, we know people who have cancer, have had cancer, have died from cancer. I think just, our minds tend to almost want to fool us into thinking, well, that's somebody else, it's not you. In many instances, nothing could be farther from the truth. When you're told definitively that you have cancer, when Dr. Belkoff said that to me, it was stunning, it was frightening, it was shocking. And as much as I tried to prepare myself for that possibility, in that moment, it really does, it hits you. At the same time, I mean, I knew that he would know what to do or how to handle it. I had tremendous confidence in him.
We evaluate patients regarding their prostate over the age of 50. It should be a routine where patients come in, have their prostate checked. Generally, we will screen them with a blood test called a prostatic specific antigen test, PSA, which gives us a baseline. If they have a low PSA and they have what's called a well-differentiated cancer, meaning that it is well organized, it's an early stage of prostate cancer, those types of patients, we may do what's called active surveillance, where we just follow the patient very closely by checking their PSA and probably rebiopsying those patients within a year to 15 months and continue to follow them out and hope that they don't progress.
We've been monitoring my PSA for a number of years. It was becoming clear that at least the numbers were going up, which is, not the good direction. My actual decision to go ahead and have the prostatectomy came as a result of a series of other things. In September of 2020, one day I was not feeling well, a little bit of pain in my side, felt a little tired. I went to HUB, to the emergency room. They did a CAT scan, which revealed that my appendix had burst. And that I needed immediate surgery. During that time, I really started thinking about the other big thing, what Dr. Belkoff had told me a couple years before. And so I said, okay, I need to deal with this now.
When the mayor decided to take the next step in his treatment, I introduced him to my colleague and partner, Dr. David McGinnis.
Some men choose surgical treatment of their prostate cancer. And the goal of that is to remove the prostate, remove the cancer, and avoid as many side effects as possible. Fortunately, we have modern technology in terms of robotic surgery, less invasive, smaller incisions, and men recover faster afterwards. The patients need to consider all their options for treatment and make a decision about which way of managing their prostate cancer they want to pursue.
It's a very personal decision. It's really more mental than physical. For me, it really came down to, I want to live. I want to be around for a while. I have much more, I think, to do.
When men choose surgery, then I start talking about the details about the surgery. We would go over the typical recovery. The way we do a cancer checkup after prostate cancer surgery is we check on the PSA. With the prostate being gone, if the cancer is also completely gone, then the PSA will go down to 0 and stay that way forever.
I've had the required, new baseline PSA 3 months after my surgery. And, my number was, less than 0. And the cancer is gone. I recovered from the surgery. Dr. McGinnis is incredible. Everything that he told me that was going to happen did happen, and pretty much on the timetable that he told me. But I was also fortunate to have really great doctors and a fantastic family to encourage me, support me, look after me. But I'm fully recovered, cancer-free, feeling good, and certainly taking a whole lot better care of myself these days. If I can be an advocate, if I can share, my fears and my story and the result, I want to do that. Prostate cancer awareness is critical, for men, and especially for Black men.
We know that the African American male has a much higher chance of developing prostate cancer, as well as dying from prostate cancer if they are not evaluated and treated if they do have prostate cancer.
What I would say to another Black man is get checked. Don't take anything for granted. You know, you want to be around, you want to get stuff done, you want to be with your family, you want to be with your loved ones, and you want to have a good, healthy quality of life. You know, there's living and then there's living. If you are on the other side of it, like I am, tell your story. The more people hear from any one of us, no matter, you know, what your station in life is, what you do or have done for a living, tell your story to others. We want people to live healthy, long lives. And the only way that's really going to happen is by taking care of yourself.